So the report states that for smoke-free nicotine alternatives to be an effective harm reduction and tobacco cessation public health strategy, a robust and risk-proportionate regulatory framework is a requirement. What are your thoughts on this statement?
I think that for tobacco harm reduction to be successful, all of the market participants and the public health actors must have clear understanding of comparative harm between cigarettes and reduced risk products such as heat-not-burn, snus, or nicotine pouches. And scientists and public health actors, including doctors, are the most important non-industry stakeholders in accelerating tobacco harm reduction measures through risk proportional regulation. A continued education on the best available science is needed, and the most important thing is the doctors must be protected from retaliatory measures if they speak up about harm reduction, because they are afraid to speak about harm reduction. They are afraid to speak about nicotine. They are afraid to speak about how you can prevent the disease, the oral health disease. And if they start speaking about this, they can speak in congresses, and just keep in mind that all the doctors are informed by what they hear in congresses, in scientific literature. So if you stop them for speaking, from speaking, you can stop them also for being informed. And as I told you, this is the problem. They are not informed, they cannot inform the patient, so that means continuing smoking, so less cessation, so less alternative products. If you don't know, you don't use it. If you know, you are informed, so you can make your choice. So, for example, you know that you eat sugar, and it's not good for your health. If the doctor is telling you, don't eat sugar, it's up to you if you start using an alternative to sugar tomorrow, or if you are using again sugar in your with problems for your health. So this is the main issue, to be informed, and all the patient and the doctor will make a choice, a very good one. Sweden made a very good one. So this is why it's so valuable, this report, because it gives information to all the doctors and to all the people that want to be informed in this.
Yes, yeah.
I mean, you ask, and I'm going to joke a little bit, but you're asking the question of risk proportional regulation as if we are reinventing the wheel. Well, in reality, risk proportional regulation is what politicians apply for everything they regulate. So the higher the risk, the more the restrictions, the taxes, the bans, the lower the risk, the lower the restrictions. For example, many countries have reduced or even do not apply any VAT in helmets. The UK, for example, the UK government, there is no VAT for helmets. I've never heard of any government saying that because helmets normalize motorcycle use and motorcycle use is more dangerous than driving a car, let's double the price of helmets so that we will not encourage anyone to buy a helmet and use a motorcycle. Well, you're laughing at that, but that's exactly what many governments do concerning harm reduction products. They apply more restrictions, they add taxes in products that are already more expensive, some of them, which are technology products, are by definition, the production cost is higher compared to producing tobacco cigarettes, but they are adding more restrictions, they're adding more taxes, they make these products less accessible, while at the same time you can get cigarettes within walking distance wherever you are. So it doesn't make sense at all. So don't laugh with my example of helmets, because it's very similar to what we're doing with tobacco harm reduction. But we're not laughing at it. It costs lives, especially in countries, and that's even more strange, that countries which have very limited resources devoted to smoking cessation are the countries which are implementing most of the bans. And it makes no sense because they don't have any other alternative. They cannot provide to the population smoking cessation services. I can bring the example of India, of Indonesia, 60% smoking rate among men in Indonesia, 65% tax on e-cigarettes. Doesn't make sense. They're more expensive than cigarettes. It makes no sense. I was in Indonesia once several years ago, and I was speaking to some regulators, and their concern was that there are kids who will initiate vaping. And if you go on YouTube, you will see 7-year-old kids from Indonesia smoking. So I showed him a video on YouTube of an Indonesian kid smoking at the age of 5 or 7, smoking like crazy, like a long-standing smoker. And I said, this is your problem. And you're talking about e-cigarettes being used by some kids based on some anecdotes. And you have your smoking problem on YouTube, on display. They don't seem to get it. And I need to emphasize what Anders said about the WHO overreach. It's an overreach, a dishonest overreach that doesn't make sense. But it is so persuasive because for many people and many governments, WHO is perceived as some sort of a religion. And they get persuaded by things that don't make sense, that are completely irrational. India was congratulated for their decision to ban e-cigarettes. Before the ban, you couldn't find e-cigarette products anywhere in India. You need to search quite a lot to find a vapor. You couldn't see people vaping on the streets. After the ban, India has been flooded by black market illicit products of unknown origin and unknown, of course, quality. In every street, in every corner of every street of every major city in India, you will now find e-cigarettes being sold by any sort of person you can imagine, not by vape shops. And the government pretends that they don't exist because they have banned them, but not only have they banned the product, they have prohibited research on the product. So they have banned scientists from doing any sort of research on the product in India. Officially, that's not unofficial. There is an announcement by the government that you're not allowed to do research on e-cigarettes. And now the country is flooded with black market products. No one knows where they come from. There is no quality criteria. There is no control by the government, nothing. So they pretend they don't exist, and they are everywhere now. So they created a problem that they didn't have before with no regulation. So the regulation that they introduced caused the problem, but they still don't get it. And they are still being congratulated by the WHO. Makes zero sense. Makes zero sense. The WHO announced a few years ago that Syria has a big problem with smoking. At the peak of the war, of the civil war in Syria, the WHO was concerned about the smoking rates in Syria. If that's not an example of a totally unrealistic and unreasonable approach, I don't know what kind of an example you can consider that, let alone that they also congratulated North Korea, of course, but that's another story, I mean. But yeah, that's the truth, you know. That's the truth. Doesn't make sense. We need to be more honest, as I said.